Women and men just aren't the same, particularly when it comes to their health risks. Women today have redefined gender roles, taken on more power and freedom for themselves, and proved their potential to the fullest. However, in the process of carving a niche for themselves, it's usually the health that takes a toll on them. The good news is that many of the leading threats for women's health, which can vary based on a woman's age and background, are preventable. Common diseases affecting women may be issues in the reproductive organs such as fibroids, endometriosis, or polycystic disease of ovaries. There may also be issues such as anemia, urinary infection, menstrual abnormalities, gynecological and breast cancers. In this episode of Let's Talk Health, we address the subject of women's health. There are also in-depth coverage of two common issues faced by women: fibroids and incontinence.
The modern Indian woman dons many hats. She is adept at multitasking, be it at home or at work. But in the pursuit to strike that perfect balance between professional and domestic roles, many women tend to ignore their own health and well-being.
Women nowadays, many of them are career women who have a work-life balance to be maintained, and they're trying to juggle various activities, and it poses a significant physical as well as a mental challenge to the women. And obviously, in their prioritization of tasks, their own health comes the last, which is what has to change as a social thinking in the whole country, so women's health is progressive in nature.
Women need to make the best health choices. To empower women, one must tackle the health issues that concern Indian women the most.
Prime Minister's initiative of making India anemia-free was a digital initiative last year, which gave insight into the magnitude of the problem which women are facing, the importance of iron supplementation, the importance of correction of anemia even before pregnancy happens, and immediate access to the healthcare system to prevent hemorrhage-related deaths around the labor or delivery period is one of the ways we can improve the chances of well-being of pregnant women as well as prevent these deaths which are happening.
Women who are 40 years of age and above should go for a thorough medical checkup every year. It may not prevent a disease, but an early diagnosis can make the difference between life and death.
Self-breast examination has to be taught to every woman, and they should be doing it after every menstrual period, so they themselves can detect any abnormality in the breast and approach a doctor for further screening and investigation. Breast screening program in the form of inclusion of mammogram has to be done in women above the age of 40 and above the age of 50 annually or biannually on the basis of how the risk factors for women are. This is very crucial in detecting early cancers, whereby we can prevent advanced breast cancer and death due to breast cancer.
Women's health requirements should be looked at holistically, beginning right from birth and progressing through the various stages of womanhood. In this episode of Let's Talk Health, we will look at two stories related to pelvic floor disorders which generally affect middle-aged women, and learn about their diagnosis and surgical treatment. Stringing these gems together to craft handmade neck pieces is what keeps Hema Sunita occupied most days. It's a hobby that she is most passionate about. one that demands her to be seated at one place and concentrate for hours on an end. But until some time ago, even a brief period of sitting would cause Hema discomfort. She would have to let go of the task in hand to frequently rush to the bathroom. Hema was suffering from urinary incontinence, a condition that caused a serious impediment to her personal and professional life.
When I have a male boss, and when I was sitting with him, if I had coughed or sneezed, there would be a leak, and then I would immediately jump out of my seat and rush to the washroom. And the boss never understood why. I was amidst a conversation, I was leaving the room, going out and then coming back after a few minutes. So this was happening repeatedly. And if I was with my friends, I never could laugh freely, even over a joke, because I felt, okay, there might be a problem with me, so I should control myself. So every time there were this, I was holding myself. I would use a sanitary pad, go prepared with using a sanitary pad for the occasion, because that was the only way I knew how to temporarily encounter my problem.
Urinary incontinence is basically involuntary leakage or escape of urine in women, but particularly when there is a tendency to go to the washroom. So there are two types of incontinence pertaining to women. One, what we call the urge-related incontinence, and one which is called stress urinary incontinence. In general, women tend to have a good bladder capacity, which is better than men, about 500 ml bladder capacity. And when they need the urge to visit the washroom, they will be able to exercise control of the bladder and no leakage happens. But in certain women, when there is an overactive bladder, there is a lack of this control, and when they feel the need to go to the washroom, they leak even before reaching the washroom. This is called urgency-related incontinence. Usually, the cause for it is an irritable or an overactive urinary bladder. Second problem is what we call stress urinary incontinence, which happens due to the weakness of the pelvic floor, which is the muscle which supports the bladder. And this gets weakened whenever the woman coughs, sneezes, laughs, exercises. There is a laxity of the pelvic floor. The support to the bladder is lost, and the woman leaks urine involuntarily. This is a problem which tends to happen after repeated childbirth or after menopause.
Hema was 43 years old when she became a mother for the second time. It was soon after the delivery of her twins that she started suffering from stress-related urinary incontinence.
Like almost twice a month, I used to have a UTI for which you were taking some kind of antibiotic or trying to, face the problem, as I would say, in terms of, because UTI gives you a lot of discomfort in terms of work. You don't know and how frequently you pass the urine.
These women have this learned habit of trying to restrict the water intake to avoid the need to go to the loo very frequently, and that is when they tend to develop a significant repeated urinary tract infection. So it is not only a psychologically depressing one, it interferes with their activity, it interferes with the daily routine, it restricts their cultural practices, it has a serious impact of their intimate sexual life, and it does put them into deep depression.
Frustration coupled with the willpower to put an end to this constant problem led Hema to seek help from her gynecologist. She went through a test of urodynamics, which revealed the necessity for a corrective surgery. Urodynamic tests for urinary incontinence are measurements taken to evaluate the amount of pressure experienced by the bladder and urethra.
She emptied the bladder completely. There was no significant residual urine left behind in the bladder even after emptying the bladder. So the second part, when we filled the bladder to understand the pressures, she had a very stable bladder very compliant bladder with good capacity. However, on asking her to do the provocative test of coughing and bearing down, what we call the Valsalva maneuver, she had an involuntary leakage of urine, which confirmed that the diagnosis was a stress urinary incontinence with a stable bladder. So she was a safe candidate for going ahead with the incontinence surgical procedure.
After the initial test and an extensive discussion with her gynecologist, Hema underwent a TVT, or tension-free vaginal tape surgery, to cure the problem of incontinence.
Is a short form or an abbreviation for what we call a tension-free vaginal tape. This is a proline tape which is kept underneath the bladder neck, especially the mid portion of the urethra, through the vagina with a single incision, and the tape either comes out beneath the pubic bone suprapubically or in the groin area, thereby acting as a hammock or a suspension for the mid-urethral position. So if you can imagine the urethra, and this acts like a hammock, whenever there's pressure applied from on top, this doesn't descend down and there is no leakage. This offers the counterpole whereby this is supported very well and no leakage of urine happens even on applying pressure.
Even before I knew I was bleeding to the theatre, I was out of the theatre. So soon I realized, I'm up and about in the post-operative ward, lying down on a bed, and one never felt any pain even at that point of time in the hospital, or even when I left the same night, followed by a couple of nights later.
Within 2 weeks of the procedure, Hema made a full recovery and even started accompanying her husband to the gym. She would spend a considerable time in doing all kinds of stretching exercises.
Someone tells us a joke and I find that my wife is laughing openly, or that she goes to office and with the best of sarees and not scared that she's going to mess it up, or that in the gym also she can do various things that she could never do previously, and which she used to enjoy doing and keeping in shape and fit for life. So I feel that surgery has really transformed her life. And the more the days go by, the more we find that what a difference. Just today in the morning when we went out and we found something funny on the road, and she laughed out loud. She said, till today I keep thinking that maybe I'm not used to the fact that I don't wet anymore. So she says, it's still the transformation is coming about, that no, you don't have to worry.
Be it sharing a good laugh with her husband or running around with her daughters. Today, Hema is busy catching up with things that she had to forego prior to the surgery. She is living life on her terms once again. On the other side of the break, meet Sasikala, who got operated for uterine fibroids to lead a much healthier and happier life. Sashikala Ashok is happy to be back in the driving seat after months of being dependent on others. As she drives to her friend's place to meet and spend time with her, Sashikala senses an enormous amount of freedom in her life today. But it was not so long ago when her life had started moving in reverse gear. Shashikala was diagnosed with fibroids in her uterus. A mother of a teenage daughter and a homemaker, 45-year-old Shashikala was in a state of shock when she first learnt about her health condition.
All I went was to treat myself for a urinary tract infection. When I was told I have fibroid, which is complete news to me. And actually I argued with her also. Then if you say that I have a problem like a fibroid, then why my periods are regular? She said, no, that is not the thing. Sometimes all this also, these things happen. You cannot still say that just because you had your periods on time and your bleeding stopped right on 5th day does not mean. Actually she said, that's the time she told me that you would have had lot of clots, not normal bleeding. Lot of clots, which a lot of people think it's normal. That is the thing which says that you're not normal.
Fibroids are lumpy growths in the wall of the uterus because of the muscle tissue which is overgrown. These are usually benign tumors that can be either deeply seated within the muscle layer or can be encroaching into the cavity of the uterus.
If you take an average, a normal menstrual cycle lasts between 2 to 7 days with an average flow of 80 to 100 ml per day. If there are clots during the menstrual period, if there is flooding, if the woman needs to have double protection, and if they have nighttime flooding, if they have fainting episodes during their periods, or they are rendered anemic with the loss of hemoglobin because of the heavy flow during periods, or experience heavy flow associated with severe pain during periods, this could be suggestive of presence of fibroids in the womb of the woman. Certain fibroids grow to an enormous size, causing significant increase in the size of the uterus, mimicking that of a pregnant size, right up to 32-34 week size uterus.
Although Shashikala wasn't planning a second child, but she had a deep resolve to protect her uterus if it was clinically feasible.
Probably you're compensating well because you're still young.
This led her to consult many doctors until she found a urogynecologist who was in favor of performing a surgical procedure called myomectomy.
She saw the scan report and she said everything, what you're saying is 100% right. Your uterus is actually fine. Your ovaries are fine. In your case, you can definitely retain your uterus because this is in the outer walls of the uterus. The fibroid lies in the outer walls of the uterus. So fibroid alone can be removed. This was the first thing she said. She is the first person I met who said my uterus can be preserved. It was extremely, kind of moment of joy for me.
Her hemoglobin was only 5 or 6 grams, which was a very severe degree of anemia, but it was chronic in nature because she had not become symptomatic in terms of being breathless or other features of severe anemia, but she definitely complained of severe exhaustion even during normal household chores. On examination, she had a huge fibroid, about 8-9 centimeters in the back wall of the uterus, mainly confined to the muscle body of the uterus and in the wall of the uterus, not jutting into the cavity. I corrected her anemia by giving her IV injections of iron infusion, and with 3 or 4 her hemoglobin came up to a good reasonable amount of 11 grams, which was good enough to get on with the surgery. Myomectomy is comprising of 2 halves of the single word. Myoma meaning fibroid. Anything which is ectomy means removal. So in simple terms, removal of the fibroid alone is called myomectomy. So the fibroid could be in the outer wall of the uterus, within the wall of the uterus, or inside the cavity. For her, it was single fibroid, the blood supply was mapped, it was much more on the muscle wall, emanating up to the surface, and it was feasible to do. The sheer size of the fibroid and the access to this particular back wall of the uterus was a much more a challenge if we were to do a laparoscopy or an open surgery, which is why the robotic approach was preferred.
Traversing along the ups and downs in Shashikala's life is her husband Ashok. It was his immense support that made her take the decision of surgery sooner rather than later.
I think all the women go through when you discuss about a surgery, especially a vital surgery like this. That insecurity of the husband supports half the insecurity is gone. You know you can face it. First of all, it's a big confidence, and he made me feel that have this confidence. He was the reason I went ahead with the surgery because he was completely there supporting me completely.
Sashikala underwent a robotic myomectomy in April 2015. The surgery was successful and the entire fibroid was shelled out effectively.
No remaining fibroids were left. She didn't drop her hemoglobin that much, and she was discharged the very next day. The recovery was pretty quick. She was even able to attend a social function within a week of surgery. On follow-up and a repeat ultrasound, her hemoglobin remains 12 grams, which she has never had before the surgery, which I had already explained she had in the range of 5 or 6, and her repeat ultrasound did not reveal any new fibroids or remaining fibroids.
And raise your hands up. Now look into the left hand, same procedure, exhale, go down.
She made a speedy recovery. Within 4 weeks, she was practicing yoga with her personal trainer.
Breathing, very important. No holding the breath.
It helped her re-strengthen the pelvic floor muscles, which is critical after the procedure of myomectomy.
When the problem is very small, it's easy to treat, but if you develop into a big thing, you can't even treat it. No?
The surgery has been a life-changing experience in more ways than one. It has brought Sashikala closer to her teenage daughter.
Actually, it might be a very small, trivial problem also.
She believes that educating her daughter about women's health concerns will only empower her to make better health decisions in the future.
As a mother, when you've gone through few things and when you talk to your children, this is how life is, this is wrong, if this happens, we have to consult a doctor. Why is it important to maintain personal hygiene? And all those things, when you talk, they know that it is for sure going to help them.
Shashikala's menstrual cycle is back on track, enabling her to lead a healthy and a stress-free life.
Hello everybody. I'm here to give you a quick update on Mrs. Sashikala and Mrs. Hema. In this episode, we saw two middle-aged women going through complex health issues. Mrs. Sashikala, who underwent a robotic myomectomy, was discharged after 24 hours and has made a smooth recovery. She has resumed living a normal yet healthier life. The second patient, Mrs. Hema, who underwent incontinence surgery, was discharged the same day. After recent review, she remains active with no other concerns. Folks, it is always in your best interest to take care of your health. Your life is truly priceless. Treat it like the gift it truly is. Till we meet again next week on Let's Talk Health. Goodbye for now.